Good morning, everyone. I'm Lucas Mathews, and I'm very pleased to introduce our next speakers for the first session of the day, which will cover an overview of the concept of genetic responsibility. First up, we will have Dr. Silke Sheikhtans. She is a full professor for cultural and ethical studies of biomedicine at the University Medical Center Göttingen, as well as Deputy Director of the Institute of Medical Ethics and History of Medicine. With a background in biology and philosophy, Dr. Sheikhtans' research focuses on the cultural and ethical study of biomedicine. After Dr. Sheikhtans' talk, we're going to have a discussion led by Dr. Lisa S. Parker of the University of Pittsburgh. Dr. Parker is a professor and director for the Center for Bioethics in Health and Law, the Dickey, McCamey, and Chilcote Professor of Bioethics, Professor of Human Genetics of the Graduate School of Public Health, and Director of the Master of Arts in Bioethics program. She is a philosopher who has published extensively on ethical concerns related to the design and conduct of genetic and mental health research. With that said, I'm going to hand it off now to Dr. Sheikhtans. You are muted.
Okay, now I'm not muted. I'm now sharing the screen.
Yes.
Okay, now it works. Sorry. I'm so sorry for saying this stupid sentence again that I'm muted. Well, thanks a lot to the organizer to giving me the opportunity to share thoughts and considerations about an issue which occupied my mind and my work for almost now a decade, which is the relationship of genetics and responsibility. And I feel very honored by the organizer that they give me the opportunity to discuss this with this great mixture of scholars and also so many, with such a large audience. What I will do in the next minutes is presenting a conceptual approach to this very rich concept of responsibility. And I will do so from bringing together more philosophical approaches and my own insights from empirical bioethics. Let me start with this provocative health campaign I found once. And as you see, it says, this year, thousands of men will die from stubbornness. And for me, it's a kind of paradigmatic example how sometimes implicitly the moral language of responsibility takes now place in, for example, public campaigns or direct-to-consumer genetics, somehow implying that it's your own responsibility if you do not take care about your body or you do not take preventive medical tests, as this campaign says. And I think this is some kind, for me, the starting point why it's so necessary to understand what is the hidden message of this type of responsibility. And as Paul just already explored in his very rich material, I think there are much more layers of responsibility, so in plural, so to say, which we need to have in mind when we want to reflect on responsibility. This example, however, also should show my personal interest in the everyday life practice, so to say, and I think that bioethics should engage with the way how people talk and think and use concepts of responsibility, and not just refer to the more perhaps abstract theory in moral philosophy. So my own point in research was always, or is always, a kind of what I call praxiological point of departure. And I think many of you know and have worked even with the concept or phenomena on genetic responsibility. For me, it's a key term in medical sociology and of course also medical anthropology for understanding laypersons' moral attitudes towards genetic information. And we tried, so to say, to capture and to dig out the richness of this term by doing a kind of reviewing qualitative research, which was published in Frontiers of Sociology a couple of years ago. And what, so to say, characterized genetic responsibility, I think is already very indicative about the different meanings it has. So, for example, Carlos Novers and Nicholas Rose have pointed out that it's often related to a kind of moral obligation that is related to collectivized genetic identity, or even to citizenship. Thomas Lemke has pointed out to the practices of self-blaming or blaming others. Others, for example, also Nina Hallowell, which is in the audience, I just saw, and colleagues have shown that it somehow leads to different versions or practices of deliberation of to disclose or not to disclose genetic information among family members. Others, as Weiner has pointed out to the, I think, very important point, that somehow genetic responsibility is also depending on lay people's understanding of disease etiology and management. And in our own research, we also found that genetic responsibility can serve as moral motivation for research participation. So it seems clear that the theoretical premises underlying the concept of responsibility that all these scholars have used and share somehow also, so to say, form or preform scholars' perception and analytical lenses. And this is somehow also my starting point by asking whether this, whether we can broaden, so to say, our analytical lenses by having a more enriched understanding of responsibility, and why this might be helpful, I want to say in the next slide. So first of all, I want to point out that the concept and the way how we use responsibility in moral philosophy, in law, and especially in everyday morality is very big, and it has a great vagueness. How and when we use the term responsibility in hidden and sometimes in explicit terms. Second, the current literature somehow pointed out that there is often more this kind of individual responsibility that is shaped or addressed by public health or bioethics, and or it's even sometimes labeled as responsibilization in the debate. However, I think if we, so to say, equate responsibility automatically with individual responsibility, we risk to neglect other agents and other models of responsibility. And this is, from a moral point of view, problematic. And thirdly, and I think this is already quite nicely introduced by the presentation of Paul, that the empirical relevance responsibility has, I think, justifies the need for a very precise model or concept that allows us to dig deeper, so to say, into this, in the many versions and models of responsibility. So my following attempt is to present some theoretical conceptual considerations of how responsibility could be understood in a more comprehensive way, and also to use it as an analytical tool for empirical bioethics. And I'm here relying on work I did with my colleague Mark Schmieder. And the first of all, I think, to our understanding, after reviewing and analyzing the richness of literature, especially in moral philosophy, political philosophy, and legal studies, is to make a point that for us, responsibility is not one ethical approach among others. Instead, we understand it as a meta-ethical formula And what do I mean with meta-ethics? So meta-ethics is the attempt to understand semantic, epistemological, or even psychological presuppositions of moral language and moral practice. So to have a more detailed understanding of what responsibility claims mean, let's start with a very basic form you always know and you have come across, I'm sure. So someone is responsible for something against someone. So someone is, in moral terms or in meta-ethical terms, it's the moral subject. Is responsible for something or someone, that's the moral object, and against someone, that's the norm-proving authority. However, this basic form is often too vague, and it doesn't really, I think, capture what actually our moral claims really contain. So we suggest that this formula should be enriched, and this goes back to other philosophers who have argued that first of all, we need also additionally to differentiate between responsibility claims that are retrospectively or prospectively organized, so to say. Second, that also the norm-proving authority is linked to a certain basis of norm standards, and that we always have also certain consequences in mind when we talk about responsibility. So, and these consequences could be positive ones or negative ones, sanctions or even reward. And to explain this in more detail, I will now go and try to use an illustration we developed to explain a bit more why we think that these different relators are much more helpful to understand the concept of responsibility. Okay, this is our try to illustrate what we wanted to say. And so first of all, I'm not sure. Can you see my mouse? Okay, perhaps you can see. So on the left side, there is this moral subject, and somehow it acts in a responsible or sometimes irresponsible way towards the moral object. And then the idea of this norm-proving authority is that is somehow it needs a basis of norms to, so to say, to judge or to give a moral assessment, so to say, whether this was a responsible or irresponsible action. And then depending on this judgment, we have these consequences, which can be, as I said, sanctions and rewards. And therefore it makes also a huge difference, as I will argue in a few seconds, whether we argue or ever we apply concepts of responsibility in a backward version. So whether we judge retrospectively an action as responsible or irresponsible, or we do so and use it in a prospective way. This other illustration should also make a strong point why I think that responsibility is really a helpful tool for analyzing social practice, because instead of other ethical theories, which sometimes have a tendency to, so to say, be intransparent, whether they are, or so to say, what they are intransparent about their social philosophical background, in the sense whether they are communitarian or liberal, or more in a liberal societal concept they belong to. I think that the responsibility concept always relies on the pre-assumption or the premise that there is a social relationship between the moral subject and the moral object. And therefore, I think it's very useful, so to say, to analyze also social interactions. And then with the second axis or figure part I want to illustrate, that then I think the whole question of responsibility really depends on our secondary and assumptions, how the moral principles we think that are underlying the concept here, or the action of responsibility, or the description of responsibility, depend on what we think or who we think is the norm-proving authority, and how far, so to say, this authority can lead to particular types of sanction and reward. And furthermore, which is another point I haven't mentioned yet, and this is very relevant when it comes to genetics, for example, is the underlying assumptions regarding causality. So how do we really assume, and it's really reasonable to assume, that the particular action of the moral subject has led to a particular outcome? And then, as I already mentioned, there is the fourth dimension, and this is the time or the temporal direction of this action, whether it's retrospective or prospective. Okay, now to be more practical, let me give you two examples which you might find very common in empirical material, interviews, or even in a bioethics discourse. So the first example is a sentence, for example, which could be an observation we made in our own studies, and it says, Lisa feels responsible for following a healthy lifestyle because of her genetic risk for colon cancer. And the other example is, the doctor has to take the responsibility for his manipulative informed consent practice and lost, therefore, his license. So both sentences, in my understanding, absolutely correctly refer to concept of responsibility, but they do so in very different ways. They are different models, so to say, of responsibility, because the hidden, the implicit relata are very differently filled in, so to say. So if we go to the first example, it's obvious that this is a kind of individual responsibility, and the individual seems to hear in this effective observation being responsible or feels responsible for herself. But the interesting question is already, what exactly is part of herself? Is it her body, is it her health, or is it her identity? Also, this sentence is a prospective one, which means all actions are future or forward directed. And what is here the norm-proving authority? At least in my interpretation of the sentence here, it's her conscience. So it depends on whether she has these internalized norms of well-being or perhaps not harming herself. However, the question here also is already that should be raised, is there really a causality that makes sense, so to say, that makes it reasonable? And we might discuss later whether it's often assumed that a healthy lifestyle can help to minimize genetic risk, but sometimes the evidence for this is quite low. And also an interesting question is, even if she feels responsible, what are the consequences in such a case? To my understanding, perhaps it's most likely that there might be some kind of regret in case she would get then colon cancer and then regret that she didn't very well. But in the case she stays healthy and never will get a colon cancer, will she then fully feels or will get any social reward, or will she feel be satisfied? I think that's another interesting question. In the second case, it's clear it's also an individual, but here the role of the doctor, which is often assigned with particular role expectations, has responsibilities, has a social relationship to patients. And the whole idea of responsibility here is more a retrospective one. And at least in this sentence, we can assume that the norm proving authority here was perhaps a court or some kind of this kind of legal authority. And the underlying norm here is professional law that, for example, expects doctors not to use manipulative techniques when they want to, when they inform patients about treatment or research participation. And here it seems there's a high evidence, because otherwise perhaps the norm-proving authority wouldn't have decided even that the doctor will lose his license. And these sanctions seem to be not only legal ones, but they can also have social and economical dimensions. So just both cases should illustrate that by such an analytical approach to this the meaning of responsibilities, it's possible, so to say, to dig out different dimensions, and then on the other hand, perhaps to see how they might cross in particular situations and context. So I'd like to go in the next minutes a bit more deeper into these different types of relator, because each of these relator would allow us to unfold a couple of really important questions then from a bioethical, moral, philosophical, or even sociological point of view. So the first relator I call moral subject. I think it's very clear that we can address here or can consider individuals like adults. But in many cases, it's often not only the individual we have in mind, but it might be even a collective, like let's say the family or the institution. But this is very interesting because a lot of moral philosophers often think there is no collective agency. So at least it would be very important and valuable then to dig deeper and to work out whether we think that in this particular case it makes sense to address the collective as a moral subject or not. It also depends on the moral status of agency, whether we believe that this individual or collective has the capacities, cognitive competencies, and so on, for example, for free will and agency. And it depends, as I already argued with the concept or with the example of the doctor, that there are also role assignments. And especially when it comes to professionals, these signify also very much the agency we address to a particular moral subject. So with moral objects, it's also interesting that here we often, in our claims and moral assessments, consider, I think correctly, that those don't need to have particular agency. Still, they might need a moral status, and this again unfolds a long debate in bioethics. Who has a moral status on which ground of justifications? And it's also interesting that we think that the self could be, so to say, the moral object. And of course, in many cases, it's the other. So just think about parent-child relationships as an example, or when it comes to entities where we question the moral status, but perhaps still think it has a moral status, but this is not the same as the moral subject has. Consider, for example, human embryos, the nature, natural diversity, future generations, and so on. So the third dimension, the third relator, is the time frame. It's the temporal direction. And here again, I think it makes it can be very valuable to analyze a bit more in depth whether these responsibility claims are considering a current action, a past action, or even an action that might be in the future. And here again, I think there's this really important differentiation between retrospective and prospective direction. Retrospective is the most important way how responsibility is framed in legal philosophy, and Iris Young, for example, has pointed out that this is what she calls the liability responsibility concept. While she herself and other philosophers have pointed out we need also a second version of responsibility, and this is the forward-directed one, which is relying on the idea of social power, social commitment, and social engagement, and this is the prospective one, which is future-directed. So when it comes to norms, and I think that's for biomedical ethics interesting, who for a long time, at least in the clinical setting, had a strong focus on the four bioethical principles. which I would say, I think they shape very nicely common professional principles. But in many other areas, we also rely not only on these full bioethical principles, but we might also rely on law when it comes to claims of responsibility. Just think about the case of data protection, which is, I think, also a very legally framed concept. Or then another interesting question is, are these norms more local, or are they even, do we really consider them as universal valid, perhaps when we think about universal human rights? And then there might be even very socially agreed norms that can be part of responsibility claims, like among a special family or community. So when it comes to authority, I think this is a really interesting point. So I think also in Paul's example, we saw that people have different types of norm authorities in mind. So first of all, of course, according to contractualistic theories, for example, the court or the society are a very dominant and even very prominent norm proving authority. But in many cases, like also in health issues, when it comes to effective forms of feeling responsibility, for example, I think it's not really the society, but it's more the norm-proving instance of our conscience. And so this is what I would call, it's more self-binding morality. And of course, it has something to do with internalized norms, but it might, in many cases, that these are not really identical or super binding in comparison to norms that are agreed upon members of the society. And then there might be religious versions of norm-proving authorities, which I would call the superhuman authorities, like God, godnesses. And finally, when it comes to consequences, I think this depends, so to say, on the authority's power. So there might be authorities who have more power in practice terms than others. Like sanctions by court are something different than if you say, okay, the community, somebody is responsible towards the community, but the community might not really have a power, so to say, to impose any sanctions on this person. And that's the same, so to say, with positive consequences. And in some cases, we might feel that taking responsibility should result in positive social recognition or social rewards, but it might even in practice very weak. And so I think the impact and the reward for the person who did something correctly or even perfectly might be, so to say, remain very weak. So I'm almost at the end, and I'd like to conclude. What I wanted to argue is that this type of responsibility conception I provided here should or could serve as a helpful hermeneutic tool to describe moral accounts and social relationships. So it has the power, the analytical power to unpack different accounts of responsibility and make them more transparent, and hence by this, I think, allow a much more in-depth analysis. I also would, there are a couple of colleagues who have tried to use this, and I think their work has shown that this type of tool can help to unpack also hidden conflicts and show, so to say, how often implicit premises are in responsibility claims or assessments, which are but then perhaps not very reasonable or can be easily rejected, or even at least in a reflective version be revised. And then a third point, I haven't talked about much about normative categories. When is it really justified to employ responsibility accounts in particular occasions? So to say, it's very clear for me that all kinds of description of responsibility must be always justified according to normative reasons and not just empirical findings. So the fact that people claim parts themselves or others for something responsible does not automatically mean that in normative understanding they are responsible. So I think this is again, there is an odd gap between empirical analysis and then the normative considerations that are following out of this. So I hope I'm in time. And so I'm looking forward now to Lisa Park's comments and then to the discussion in the following session. Thanks a lot for your attention.
So thank you very much. I'd like to thank the organizers, most certainly for the discussion that will unfold today. And I want to thank Dr. Sheikhtans for sharing some articles of hers with me some weeks ago. And in fact, those form the basis for my remarks today. They prompted me to think of one component that might be a useful addition to her formula of responsibility in the context of genetic risk. And I read her articles in the context of thinking about genetic risk, and indeed the titles often or typically referred to genetic risk or genetic responsibility. So I hope that this addition might be a useful one for today's discussion. The component that I would add is specific increased attention to the role of people's beliefs about what genes are responsible for, and perhaps how they are responsible, in what sense, to what degree, and under what conditions. Examining people's beliefs about the responsibility of genes is important for empirical study of what people do, how they manage and make use of genetic information, and what responsibilities they consider themselves and others to have vis-a-vis genetic information. And beyond these sociological, psychological, and behavioral studies, to address normative questions of what responsibilities with regard to genetic information, agents or agentic entities should have, it's important to know what genes are responsible for and to what degree. Even the specific mechanisms of causal contribution may matter for determining what people should do. A conceptualization and analysis of what we mean by genetic responsibility, a determination of what people should be responsible for or responsible to do vis-a-vis genetic information, depends in part on what they're justified in believing about genes' causal responsibility or contributions. Silke does not ignore this point. She concludes one of her paragraphs saying that, quote, responsibility is much more relational and context dependent because its explanatory character is influenced by various understandings of causality, action, reaction, chronology, functionality, counterfactual implications, and so on. Furthermore, belief in the genetic determinism of many diseases and bodily functions and scientific skepticism can be seen as epistemic challenges, raising the question of the extent to which our perception of genetic responsibility in genetic risk cases is framed by the way we understand the role of genes in the etiology of a particular disease, end quote. She also acknowledges that, quote, causality is an important part of responsibility assignments and judgments. And she then notes that it's problematic to equalize or perhaps equate causality and responsibility in the moral context. She tends to focus on the causal responsibility that obtains between a moral agent and a consequential action, like informing family members and thereby disrupting family relationships. And she thinks of causal responsibility as being of greatest importance in the context of retrospective responsibility, as when courts assign liability for a professional's past failure to meet a standard of care. She also refers to the epistemic or causality dimension of responsibility and contrasts it with the normative approach or concept of responsibility, for which she presents her formula of responsibility with its 6 relata. I would suggest that it's now becoming more clear, but I would not suggest this until I don't skip a point in my notes. I worry a bit that emphasizing this contrast between the epistemic and the normative invites 2 potentially misleading ideas. First, the irrelevance of genetic causal responsibility for people's responsibilities regarding genetic information. And second, the absence of a normative dimension in identifying causes. These 2 mistaken ideas are related, and these are not mistakes I'm attributing to Dr. Sheikhtans, but is instead something that I think might flow from some comments that she made, misunderstandings of her ideas. I surprise myself to be suggesting in response to Silke's approach that she or we need to pay more attention to the causal responsibility of genes. I hasten to add that I suggest we pay more attention to them, to genes, so that we notice their relatively lesser causal importance in comparison to other non-genetic factors, at least in many cases. Also, so that we notice the social impulses, the values, and the normative assumptions that lead us to take this genetic turn. In the early days of the Human Genome Project, the primary sense of genetic responsibility that raised normative concerns was, I think, concern about whether genetic determinism or belief in genetic determinism posed a threat to free will and the possibility of moral responsibility. Perhaps more immediately and practically, the concern was about the impact of beliefs in the causal role of genes on health behaviors and human well-being. How would individuals understand the causal impact of genes on their health and the possibility of their intentional actions? How would they act in light of their understanding? I would suggest that today, now, it's becoming more clear that moral risks lie in a particular preoccupation of societies and social institutions with the causal responsibility of genes or the genetic contribution to disease and other human problems. The ethical and social risks reside first in the tendency of these agentic collectives to put their money on, or literally invest their research budgets in, understanding how genes are responsible for traits and disease. And then in implementing that understanding, or I'd argue in many cases prematurely implementing incomplete understanding. I'm not sure how well Silke's formula of responsibility can reflect this social embrace of or normative stance toward genetic causal responsibility, nor am I sure how well it would reflect a responsibility to call into question this normative stance. Nevertheless, I think it's important to analyze and take up this responsibility, an ethical and epistemic intellectual responsibility, if we are to be able to accurately identify and fulfill ethical responsibilities with regard to sharing and using genetic information. Now here I was interested that today Silke made reference to communitarian ideas. And I wonder whether her formula actually reveals or obscures liberal norms, neoliberal values, communitarian commitments, the different understandings of the social relationship that she's identified. I'm also not sure about the degree to which Silke's formula of responsibility is intended to be a general analysis of responsibility, or instead is primarily meant to illuminate responsibilities of various parties vis-a-vis genetic risk information. I'm also not sure that it really matters, that the intended purview of her matrix really matters. Last fall, during an ASBH, an American Society for Bioethics and Humanities meeting, I was on a panel discussing the responsibilities that siblings owe to each other with regard to sharing genetic risk information. And it's surprising how little has been written about siblings' responsibilities. Silke's formula would have added clarity to much of what we discussed. But at least provisionally, our panel concluded that for siblings to determine what responsibilities they had, there was nothing special about the information being genetic risk information. Whether the information was about genetic risk, an environmental hazard, or an interpersonal threat, what mattered were kind of the usual considerations, like the information's reliability, what could be done in light of it to avert harm, whether the harm might be great or small, whether there was alternate access to the information rather than another sibling, the nature of the sibling relationship, and so on. That the information was genetic did not seem really to matter. Similarly, as far back as 1998, Alan Buchanan considered clinicians' responsibilities regarding disclosure of genetic risk information. He argued that within the reproductive context, because people's values often differ and respect for reproductive rights is an important ethical and social norm, taking a non-directive genetic counseling approach is appropriate. But outside of that reproductive context, he argued, genetic exceptionalism should not prevail, and people's preferences should be given no greater weight with regard to receiving genetic information than other health-related information clinicians use in medical contexts. Instead, the validity and utility of the information in the context of the patient's values and life plans should determine clinicians' responsibilities with regard to genetic risks. Now, in contrast, yesterday, and in fact later today, I'm participating in an NIH and NHGRI Genomics and Society Working Group meeting, where we're discussing the disclosure of polygenic risk scores. Here, responsibilities do seem to depend substantially on the fact that genetic information is involved. Precisely because, most of us would agree, we don't yet understand what the genes feeding into polygenic risk scores are causally responsible for, how, under what conditions, and to what degree. The nature of the information really matters. And it is the full nature of the information, not just its quality in the sense of validity, reliability, actionability that matters, or even that it's about genes. Part of what I mean by the full nature of the information is that this information being generated and implemented, it is being generated and implemented with a particular valence of being worth pursuing, implementing, figuring out, unfortunately often in that order, because of a commitment to particular values. The pursuit and use of polygenic risk scores reflects a willingness or a desire to locate the actionable cause of ill health in individuals, in their genes. Perhaps an impulse toward individualizing in identifying the cause and locating the site of intervention. Determining when we have adequate understanding of the causal contribution of genes to say that we have genetic risk information is a normative matter. There are many social, political, and economic values and incentives shaping that determination. Some of them, I would argue on another day, are not the most ethically justified values or incentives. Here again, Silke's articles offer a useful conceptualization. She speaks of a prospective sense of responsibility as being in charge of or taking care of future events. Another feminist philosopher, Joan Tronto, speaks of taking care of unmet needs. Tronto argues for assuming the responsibility to take care of unmet needs, primarily because one possesses the competence and the resources to do so. I'm suggesting that some of our current attempts to implement genetic information outstrip our current competence and understanding. Perhaps existing resources, financial and intellectual, might better be redirected to address unmet health-related needs or educational needs or behavioral needs without relying so heavily on genetic information, particularly genetic information about particular people. We have, I suggest, a responsibility to identify and act on some of these concerns regarding genetic information. And I think that this is an important sense of genetic responsibility. Thank you.
Excellent. Thanks both to our presenter and discussant for a very stimulating first session. I just want to remind everyone attending that there are two different ways to ask questions. So there is a Q&A feature. If you click on that box, you will be able to type out a question that we can then field verbally here, or alternatively, you can use the raise hand feature. There's a button at the bottom of the screen, and if you raise your hand, I will call you out and give you the opportunity to ask your question verbally. But with that being said, I thought that this would be a good opportunity to give the floor first to Silke to respond to Dr. Parker's comments, which were very good. So I will let that happen now.
Yeah, thanks a lot. I don't want to take too much of the discussion time, but I'm really grateful to Lisa Parker to point out a couple of issues I haven't addressed sufficiently here in the talk. And I think it's a really interesting question how you use the term responsibility exactly in a way I as a moral philosopher would prefer not to use it, namely to say genes are responsible for X and Y. And I'm saying so because I fully agree. I mean, this is a way how we commonly talk about a lot of things. You know, the weather is responsible for my headache, blah, blah, blah. But I think even if we use the term responsibility in everyday language in such an way, I think at least in late modernity, we believe, at least many of us, perhaps not everybody, that neither the weather nor the genes have a particular intention or free will to do so. And if we, at least as philosophers, so to say, promote again the term responsibility, also be appropriate for this type of entities, I would say, like then I think we do something which we normally would like not to do, namely to contribute to more misunderstandings which you just criticized. So, however, I think your point, and if I take the substance of your point, I think is something more important, and that's the question: what to differentiate in the whole debate on genetics cases when we have genes have a very, strong causality in a sense they determine very clearly perhaps future diseases, while we have other cases, as I think what you just mentioned with the polygenic cases, where it's very diffuse and we have some kind of susceptibility genes, but we cannot really make clear risk assessments how the outcome will be. I hope that was your major point. I got it correctly? Okay, and I think this is true because I think the second version, that is the level of causality, I would say, genes can have and can impact the body and health. This, of course, has and should have also on our normative judgments on responsibility when it comes to genetic information. There should be a strong link, so to say. And this might be that this relies very much, as you said, on what people understand about this kind of causality. But, and this would be my, perhaps again, more my critical point, also what people, what science, so to say, can really say about it. And I think the history of genetics has shown that in science, and especially also in the public communication about genetics, there's a tendency, I would say, for very simplistic deterministic communication. While of course, all high-level professionals, human genetics have nowadays a much more a profound sensitivity to make clear that there are many factors and so on. We know from other studies that in public understanding of genetics, there is still a risk of having a too simplistic deterministic understanding. So in summary, I would rather suggest that at least scholars and healthy scholars should not use the term or formulations like a gene is responsible for something exactly for this reason, because to distinguish between a moral agency and yeah, a natural causality.
No, I appreciate that. And I have to admit that these comments today are the first time I've ever done that. Partly, I guess, because I was playing with the multiple notions of responsibility, which do exist in the genetics related literature. And indeed, my concerns could certainly be reshaped simply by talking about the causal contribution in each case, as opposed to responsibility per se, and to emphasize how an accurate understanding of that causal contribution is very important for responsibilities, but that also that may not be all, that it may also be a matter of normative commitment as to approach of what we do in light of what we know. And I strongly suspect you don't disagree with that at all. Yes. Sorry, Lucas. And you will unmute, Lucas. Sorry.
Mute. Sorry about that. So we have about 5 more minutes, and we have a few questions from attendees. I see a hand raised from Cynthia Langley. I am going to allow you to talk now and ask your question. Cynthia?
Oh, I'm sorry. I did not mean to do that. Go ahead.
No problem. Okay, no problem. Okay, in the Q&A box, we have a few questions. We have one from Anna Lewis for Dr. Parker. Lisa, were you implying that we need to understand causal pathways before using genetic info in tests in the polygenic setting that would involve knowing this for every included variant? If so, could you go back over why you think that to be the case?
Since I could not, so in short, no, I do not think that that's the case. I was instead suggesting that knowing more than we do, having, shall we say, maybe better grounds for a better understanding of why there are the associations that we identify, and also a really careful understanding of the values that lead us to focus on the genetic side of whatever causal pathway is inside the black box that we can't yet, don't yet know, that we need to be very careful about intervening with genetic information when we don't yet understand a causal pathway, where it may sort of never be understood, where what we have primarily are either associations, population-based associations that may or may not apply particularly well to the individual before us, and so on. In short, just that it's perhaps more complicated than some of our current research and even implementation or clinical practice seems willing to admit.
Excellent. Okay, we have another question from Bob Klitzman. Thank you for a fascinating discussion. What should we say instead of a gene is responsible for a trait?
Okay, if I may try as a non-native speaker, I would perhaps say, at least if I'm a professional, I want to be very accurate, I would say, well, there is scientific evidence that this gene caused the disease with this and X and Y certainty, you know? There's also picks up, I think, Nina Hallowell's point that I think there's still a lot of uncertainty, or, I mean, we often have only statistical information, how genes, I mean, we have very few genes where a gene in 100% of the cases will end up in this disease, and many, many other cases, which are perhaps the most one we are now working on, we have risk information, and I think that should be part of the sentence, so to say.
Silke, I'd like to ask a question for you. During your talk, I was really intrigued by the relationship between whether your model was descriptive or normative, and Lisa talked about this a little bit as well, and I was hoping you could say a little more about how you've thought about that relationship, and particularly in regards to when we think about how the public understanding of genetics and how causal they are, there seems to be this dissonance, right? There's the actual causal relationship, and then there's what the general public believes to be the causal relationship from how they understand genetics. And it seems that you could have a model that is both descriptive when we characterize the way that people understand and believe that genes have a strong causal influence, but maybe you could have a normative version of your model that says we should really characterize it in a way that accurately captures the uncertain relationship between genes and the outcome.
Very good point. I personally don't have one special model that can cover all the dimensions. At least I haven't worked it out, but that's a really great encouragement. But just go back, I think one of the most important responsibilities I'm interested from a normative point of view, and this is professional responsibility towards patients when it comes to communicate genetic risk information. So for me, the most interesting question here is, I think often a couple of or many studies have shown that there is this kind of balancing between respect for self-determination versus well-being or non-harming. And I think this is always seen as then depending on kind of perhaps the ethical background theory, whether you are more liberal, then you think, okay, respect for self-determination is the most important one. So I always provide patients with genetic risk information, even if I think there's, for example, no clinical utility, just in case there's perhaps personal utility. So with this model, I would say yes, but because in my model, I would always point out what is the particular underlying moral assumption regarding the doctor-patient relationship. And I think this doctor-patient relationship is never shaped only by the idea of respecting self-determination. I think this has always to be seen also that a doctor is be seen as an authority, and the major reason I'm going to doctor is not that he respects my self-determination. This is what I expect perhaps from the state, but it's because I want to get some help because I feel perhaps I'm ill. So it always has to consider also whether there are harms, and whether these harms don't have to be only on the level of psychological, not only on the physiological level, but they can also always, or they should always address the psychological level. So from this perspective, my normative consideration would be always that any kind of disclosing risk information has to be done in a very sensitive, also I would say personalized context, where the doctor has the duty to assess whether this genetic risk information can somehow impact the patient, his relationship to family. So it would really require a very sensitive procedure, like we, for example, have it in the Huntington context of counseling, which I think is, from my understanding, a very good way of how it's done in different steps. But this is not how it's not done, so to say, in many other cases. And with my normative model, I would like to argue that we need like a very procedural approach to cover all these dimensions.
Wonderful. So we have time for one more question. And I see a hand raised from a Fred Meyer. Fred, I'm going to allow you to talk and ask your question now.
Can you hear me?
Yes.
Yeah. I would urge that a simple explanation to always keep in mind is our evolutionary background. When you're on the African plain, you're a lion's lunch if you're not part of a little group. And that means instinctively that it's deep in our brains somehow, I don't know how, that we must look out for each other or we will not survive. And I never understood this until I, decades ago, took my then 12-year-old son out to the African plain. And the Harvard evolutionary biologist who was leading the group said, we're going out in open Land Rovers, we're going to have lions who can eat you in a minute and elephants who can trample you, and you're perfectly safe as long as you stay inside the Land Rover because the animals think it's one big animal that smells bad. Well, I had a energetic pre-adolescent and I was terrified, absolutely terrified. And in minutes, we were 10 feet away from 2 lions copulating and giant elephants.
Fred, I'm afraid that I have to cut you off there. We have cut into our break time. We have precious time today, 15 minutes of break. If everyone can turn your screens and mute your microphones, and we will reconvene in 15 minutes. Thank you.